So out of all these different technologies, which ones are the ones that we can expect to revolutionize the world of cancer?
So some of these things are now becoming very standard treatments, like the antibody therapy, used all the time in various different cancers, right? And it's maybe not as massively groundbreaking and as effective as some of these cell therapies, but it's still a massively useful tool in the arsenal of doctors to use this, right? Whereas things like CAR T cell therapy, they're so difficult to make and research and produce, and it just takes ages to validate them. There's a few of them now that exist on healthcare plans, like the original ones were called Kymriah and Yescarta. These are the original CAR T cells targeting blood cancers. Also, by the way, I should say they don't really work in solid tumors at the moment. So they have had some success, but it's a bit hit and miss, and we're not quite sure how to consistently make them work really well against solid tumors. But immunotherapy is such a big field that there's lots of different things you can talk about, right? I mean, the simpler the better, and there are some that are antibody-based that are much easier to make. So you have these antibodies so diverse, you can use them for lots of stuff. Like you can even use them for chemotherapy, combining immunotherapy and chemotherapy, attaching a chemical chemotherapy onto the end of an antibody so that it only affects the cells that the antibody sticks to and not the rest of your body. So it's almost like delivering the chemical directly to the tumor and trying not to make it stick anywhere else. So it's a little bit more safe than regular chemotherapy. Or there are other things. You can attach like a glowing protein onto the end of the antibody.
Mhm.
The antibody sticks to tumor cells. In the surgery theater, the doctor can wear glasses that illuminate the glowing protein, and you can literally see the tumor glowing. So any cancer cell will be glowing bright, and the healthy tissue will just be dim. And that helps the surgeon to precisely chop out the cancer cells and not leave any behind and not damage healthy tissue. I mean, they don't need to, right? So these are some of the ways that antibodies can be used and are being used right now because they're pretty easy to make these. The
Mhm.
more complex immunotherapies, I think they will revolutionize it. They're going to get cheaper and cheaper, by the way. They're already working on ways to reduce the cost of these immunotherapies. And that's one of the big focuses of the people who make them, by the way. But they are a bit more tricky to get over the line because you're literally directly genetically engineering a cell and trying to use that as a medicine. It's quite different to what's been used in the past as any kind of medicine, right? But when
Mhm.
it is ready, it's going to be able to not just cure cancer, it's also curing autoimmune disease in a huge revolutionary way. You know, lupus, myasthenia gravis, all of these things that we could never treat are now absolutely treatable by CAR T cells. We just need to get everything approved and ready and get the costs down. And in my opinion, these are going to revolutionize not just cancer, but also autoimmune disease, maybe other things. We've essentially got the ability to program powerful cells of our body to do things now. And you can imagine what that means for treatments of very many diseases.